I'm Kieran Anderson, Group Publisher here at Applied Radiology. We're here live at RSNA, and I am absolutely thrilled to have in our booth today Tracy Cothran, who is the VP of Operations of the Oncology Division at OU Health. Welcome, Tracy.
Thank you, Kieran. Good morning. It's great to be here.
Lovely. And I'm also joined by Liv Egan, who is the Director of CT Product Marketing at Siemens Healthineers. Liv, thank you.
Thanks, Kieran. It's a pleasure to be here.
Wonderful. We're here. We're going to talk today about a recent collaboration between these two, between OU Health and Siemens Healthineers. They've partnered, quite frankly, to deliver a very unique mobile solution designed to meet the needs of patients, quite frankly, in rural communities in the state of Oklahoma, specifically as it relates to lung cancer screening. Is that right?
That's correct.
I mean, Siemens Healthineers, their mission is to help improve access to care and, supporting our customers like OU Health, who is a valued partner of Siemens Healthineers. We want to provide the imaging equipment and the resources and all, the holistic approach to, really breaking down those health inequalities and ensuring no matter where you live, you have access to high quality care. And we were really excited to, partner with OU Health in this particular project. So,
It's a great partnership. Let's talk a little bit about the patient population that you serve there.
So, Kieran, it's really important to highlight that Oklahoma does not score well in mortality. We are the fourth worst mortality rate in the U.S. And lung screening particularly is very low. We screen about 2% of the eligible Oklahomans for lung cancer screening, which is hardly even scratching the surface. We have patient populations like our American Indian population, our African American population that actually experience a much heavier burden of cancer. Not only the diagnosis, but when they do have a diagnosis of cancer, it's usually more advanced. And there's a lot to learn from that population. We recognize that limited access to these screening tools is definitely a barrier and a challenge. Education, understanding the importance of a healthy diet, reduction of obesity. We also have a considerable amount of tobacco use in our state. And so not only screening for lung cancer, but also teaching them about the importance of tobacco cessation and resourcing them appropriately to be successful.
So in terms of some of the solutions you're employing, we're here to talk about mobile, right? So I'm guessing as you go around the state of Oklahoma, many of these folks cannot get into Oklahoma City, right? So you literally have to bring the services to them.
Yeah, so at OU Health, we've had a long history of mobile mammography services that really over 30 years have created some really strong partnerships across the state with our tribal entities, universities, public schools, corporations, private sector, public. We're really using those relationships to broaden our scope for screening services. So what we have found, the key to success is really convenience. It's providing access within their community. When you have someone that is struggling with food insecurity or money for transportation and gas, it is a very large burden for them to leave a full day of work to go get screening services. They're having to make hard decisions, but when you take that screening service into the community and they can do it on a 15-minute break, the impact is so much smaller, compliance goes up, and we're able to be successfully reaching those that wouldn't ordinarily have those services provided to them.
Liv, are you seeing this as well around the country as you work with other partners like OU Health?
Absolutely. I think we've seen, particularly since post-pandemic, we're seeing, many health systems wishing to move, access to care, improve access to care, take care to the communities. And it's both within screening programs such as the lung screening program, but all types of healthcare, that decentralized healthcare out into the community. And so it's really exciting to speak to the likes of Tracy and many of the Tracys around the country who are so passionate about improving the lives and the quality of care that they're delivering to their patients.
It actually is, as Liv just pointed out, the fact that you started with a breast cancer screening program earlier on, it's not new to you. So let's kind of get a little bit into the lung cancer screening program that you're about to implement. First of all, maybe you could tell us a little bit about, from a value prop, what this means, to OU Health. How does this tie into your mission?
To impact through healing and discovery. So every Oklahoman, we believe, deserves the capability to have screening services readily available. to have access to clinical trials, which is a big piece of what we do at our NCI designated cancer center. And quite frankly, there's pockets and quadrants of the state that have very low enrollment with clinical trials. And so this mobile fleet is just an opportunity to go out and connect some dots, in a very unique way. The value proposition, I think, is many-fold. I think that it is a way, again, for us to not need brick and mortars throughout the state, but we can get into the communities and serve those populations on wheels, which is an incredible gift, because you can be in one community one day and another the next, and really have a great impact over the week's time as you work your way back to home base.
And Liv, would you agree with that? Because you're obviously, working with lots of folks around the country, right? And what are you hearing from some of your other customers as well?
Well, I think it's exactly that. People, want to take high quality care and make it available everywhere in the community, not just in the main campus of the hospital system. And patients, they face so many barriers. It's not being able to afford the gas, not being able to take the time off work, worrying if they do take the time off work, will they still, is their employer, because I think particularly with lung cancer screening, there's a stigma associated with lung cancer because sadly, and quite wrongly, I think, that many lung cancer patients feel judged by society, that their lifestyle choices have put them in this position. And so I think, mobile CT imaging is not new, but what is unique about the solution and the mobile CT coach that we've partnered with OU Health on is it's a self-contained unit. And what that really means, and what's really exciting about that, is there's no barriers to where we can take it. It has a generator on board that powers the CT scanner, and this is a fully diagnostic, high-quality CT scanner that's installed in many hospital systems throughout the country. So there's no compromise in the quality of the CT images that are being provided. The Summiton Go Up CT has Siemens' unique tin filter technology, and which is even more ideal for lung cancer screening, because you have a risk benefit when you're doing any screening and CT imaging, and the tin filter turns that low dose CT into an ultra low dose CT, but with excellent image quality. And so being able to have a solution that OU Health and the OU Healths around the US, they can go to their local Dunkin' Donuts or their community center, to the local church parking lot. There is no barriers to where we can take this, unlike a traditional mobile CT trailer. It's quick and easy to set up. So Tracy talked about going to far corners of the state and traveling back home. So that means she's moving. That screening program is in a different location every day. You don't want to be wasting 2 or 3, 4 hours setting up, before you're ready to scan.
Right.
They can park up and be ready to receive their first patient within 30 minutes, and that's really a game changer.
What kind of impact will this have, do you think, on your patient population, particularly in terms of improving access to care and health equity? I mean, it seems obvious, but, have you guys given some thought to, what that's going to look like, how you're going to measure it?
Yeah, absolutely. We will be able to quantify how many patients we screen, how many patients have findings, and then ultimately how many lung cancers we are discovering, and then their treatment plan from that point forward. There are also going to be findings that don't lead to a cancer diagnosis right away, but that there is 6-month, 12-month follow-up that we'll need to do. We are working on a plan of how we can provide those in the community as well. So timing it right so that individual that may need a 6-month follow-up, if you will, could likely have that in their own community as well. So again, lots of things about this program that have been a dream, and now it's coming true. And so I look forward to sitting down with you a year from now so we can look back and say what we've accomplished. Ideally, we're finding cancers early. Ideally, we are educating people about tobacco cessation and its importance, and what, by stop smoking and engaging in those high-risk behaviors, how that can really change things around. And again, ultimately, before I retire, I hope I can look back and see I was a small part of really shifting what oncology care looks like in the state of Oklahoma.
You guys took the time to think about who you were going to partner with. You ultimately chose Siemens Healthineers, and who manufacture and developed this system here. And as I understand, by the way, the system is actually here at
It is.
RSNA.
She's beautiful. It really was. Again, for the sake of sounding incredibly corny, it really was a dream come true. It was so exciting to see her all set up and seeing it for the first time, because you plan and you plan and you plan. And Kieran, it would be remiss of me not to highlight, this all started with a phone call of really inquiring about what a low-dose CT on wheels would look like. And what it blossomed into is my ability to work with Siemens Healthineers in Lambu Medical, which had an established relationship, had done this before, self-contained vehicle, and they fostered the process all along, that project management, that imaging expertise, specialty vehicle manufacturing expertise. You put all of that together as a client. OU Health was really a beneficiary of that relationship and that subject matter expertise. It just felt really good to have a partnership that was so solid, and I just can't say enough about how much I appreciate it. And although this one isn't on the road yet, Kieran, I'm ready to do another one. So that's a testimony to the partnership, and Liv was always a phone call away.
It did start with a phone call about 12 months ago, and I think one of the key to success is everybody being at the table, having a voice, and everybody listening to each other's expertise. And that's exactly what's happened. I have learned so much from interacting with Tracy about the operational side of a mobile program in general, with speaking with Lambu Medical and that partnership. I know far more about trucks than I ever thought, Kieran, that I was going to know about in my life. And the gross vehicle weight ratio on the roads and the legal requirements. That's really partnership, and everybody, communication and listening is the key to success.
Truly
and
is.
Having the right tools to deliver a successful mobile is what it's all about. And so Lambu Medical and their experience in the mobile trailer business, Siemens Healthineers with our CT technology, Tracy's operational experience with mobile. We've got the key ingredients to a wonderful partnership there.
What is different about this project from some of the other projects you've worked on in delivering a mobile, service to your healthcare community, to your patients?
I think the population of patients that we're serving is different. Again, the tobacco use is still comes with a stigma. Where breast screening, we've socialized that idea since the 90s. It's a very common, very empowered decision to make. So I think our eligible Oklahomans for lung cancer screening is a shift and changes. I think that actually innovation. I think that CT, low-dose CT screening, has the opportunity to really look at remote scanning and how we might do that in the future. And I think this is another highlight of why our partnership with Siemens Healthineers is so important, is because that innovative thinking and that strategic planning of the future, I think, really has some application in this particular modality that we would likely not be able to have in others. So I think for that feels very different.
Right.
And I think that, coupled with staffing challenges that we're having in the imaging discipline, it's very ripe for us to continue this partnership and really be pioneers, if you will, on what that might look like in the near future.
Tracy's touched on a really key point there, the staffing challenges. And I think, every health system is deeply impacted by workforce shortages. With the technology that's on the CT scanner, on the Somaton Go Up, we are helping support and empower, even the most inexperienced technologist to be able to get high quality CT imaging with ease, utilizing My Exam Companion, which is, guided intelligence, and walking them through the CT scan, that high end CT images, making sure that the reader has the diagnostic confidence when they're looking at, not just those potential lung cancers, but any other incidental findings. Being able to talk with partners like Tracy and OU Health in how Siemens Healthineers can support beyond just the equipment, with workforce solutions and all of those. I think that's the true value of that strategic innovation, and really getting to understand the pain points for our customers and how we can support them through that. And I think, finding individuals who are willing to work on a mobile unit, Tracy, I think is one of the biggest challenges that you face.
Yes.
Because it's not the lifestyle for many people these days to, leave home on a Monday morning and not come back till Friday and stay away from their loved ones. So I think that in itself is something that more work needs to be done.
Yeah, and we'll do it together.
Absolutely.
We'll pave the way. Our hopes are that we can, again, be pioneers in this and help others because, the entire country has work to do. And if we can be a small part in how to do that and do it successfully, effectively, and efficiently, then that's what we'll do. That's part of our mission as well.
Is there anything we haven't covered? Because obviously, as we said, we could talk all day, but is there anything that we didn't mention, Tracy?
Well, I'd love to highlight that the fact that we were ready to go, again, had our TSET dollars and that partnership to provide funding, that is a huge milestone. But I will also say the self-contained vehicle has a very optimized workflow. And so the footprint is well thought out. There's not a lot of design to it because it's thought out in the most maximizing of workflow. Again, taking care of as many patients in the field is important. You don't go 2 hours to take care of 2 people, right? If something is very long, but that's not the case here. A patient enters, registers, goes to the CT suite, gets their quick low-dose CT, exit out, and you can have a continual patient movement throughout. And so I feel like we've benefited from a time perspective. That's all detailed out. One of the things that also is offered to Kieran that we should mention is we can have real-time image submission. So when we're out in the field and we complete the CT or the day, we can be sending those images back to home base where our radiologist can interpret same day should they choose to do so. That is not something that we've ever had in the field before. So 30 years ago or 10 years ago, or just 2 years ago, or 2 months ago in our mammography, we would go out Sunday night, as Liv and I have already mentioned, work our way back to home base, and we would have a full week's of work that we then dumped on the radiologist to
but
read.
also the patient's waiting that
And
full week
that's
or 2
right.
weeks
And
for
then
those
there's
results.
distance between having it and then getting the results.
Right.
With this real-time image transmission, not only do you balance the workload for your radiologist, was incredibly important today, but you're also cutting that turnaround time for that patient that needs results, particularly if there is a finding, to almost nothing. And so I think that is also a point of innovation, a point of technology that we've never had in the mobile environment before that I think is transformational when it comes from a patient
And I think
experience.
when you think about the innovation in technology in general, that's why we're able to deliver this. Not just within healthcare and medical imaging, but within IT infrastructure. The fact that you can send a CT scan image, hundreds of miles away via the ether is, fascinating when you think back to not that long ago that you had to be sat down and pick up a telephone that was tied to a wire.
That's right.
It's so true. And you're touching on a point actually, which is kind of where I wanted to take the conversation is workforce challenges are real.
They are
right?
very real.
Sadly.
So to you, Tracy, in general, what are you seeing today, at OU Health as it relates to some of these challenges and how you're overcoming them?
CT technologists are very important resources that, quite frankly, we don't have enough of. And so we're always looking for high and great talent, particularly in our CT. Our mobile environment will be the same. Again, it has some logistical challenges that you don't have in your brick and mortar that we're going to have to overcome. And I'm not exactly sure how that's going to work, but we mentioned the innovation of a remote scanning. I think that is something that we will be diving into and learning together. If there is an application there, of course, high quality, safety of our patient will never suffer for any innovation moving forward, but we really need to start thinking outside of the box and how that will look.
Right. Do you feel that this new mobile unit, in the way it's designed, will kind of help offset some of those challenges?
I'm hopeful. I think the technology inside is very user-friendly. Again, it's the same technology we have in some of our freestanding emergency rooms. It's no different, so the quality is the same. You just happen to be on wheels, and it's fabulous to work with. And I think that any technologist that has the opportunity to do that will find that to be very rewarding. And I also think that, if you are someone that grew up in a really small town in southwest Oklahoma like myself, a big portion of my mission in oncology care is really serving the communities that I too grew up in. And I think that there's a unique opportunity for someone to choose to work in the mobile program. So they're really working and serving the very people that they've grown up to love.
And I think that's the other thing that's, the mobile workflow on the Somatom Go Up means that the technologist can be there by the patient's bedside, do a lot of concurrent activity. And I think, particularly within the screening environment, we talked about breaking down those barriers. One of those barriers is many of these patients are going to be scared. And if the technologist can be by the bedside and do a lot of the scan setup while they're still speaking to that patient, make them comfortable, feel at ease, that's a game changer, because that really reassures them and provides them with makes it less daunting.
This has been a lovely conversation, ladies.
Thanks, Kieran.
I want
It's been a pleasure.
thank you so much for coming to the Applied Radiology booth here at RSNA.
Thank you.
To talk about your new mobile lung cancer screening CT unit that you're bringing to your patients in Oklahoma through OU Health. It's wonderful, Tracy.
Thank you. And thank you to Applied Radiology for having us.